Okay, good afternoon everyone. So I'm going to talk to you today about some work that we've done between the University of Liverpool and King's College London, and it's about trying to understand more about the social patterning of alcohol use and the roles of mental health and drinking to cope with stress in terms of these associations. So firstly, the main theory in this area is called the alcohol harm paradox. And many of you may have heard this before, and it's the fact that people of a higher SES drink more, but it's individuals of a lower SES who are experiencing the greatest alcohol harms. So people from lower SES groups, so from more disadvantaged groups, are more likely to die from alcohol-related causes or be admitted to hospital relating to alcohol harms. And these effects have been shown even after we adjust for actual levels of drinking. So after adjustment for that, lower SES groups are still experiencing the greatest harms. So why might that be the case? So possible explanations include, is it about the patterns of drinking? So is it how people are using alcohol is leading to the differences in these alcohol harms, and is it that we're not actually picking that up in many of the studies that are looking into this? And if we only look at alcohol consumption, is that really telling us a bigger picture? Because someone could have 20 units equally across the week, whereas some people may drink that all in one day, for example. Or is it also about other health behaviours that are linked to alcohol? So, for example, your diet and smoking, we know that these risk factors are more common in lower SES groups. So actually, is it not just about alcohol? Is it all about the bigger picture of health behaviours? So the work that I've been doing is looking at mental health in terms of the alcohol harm paradox and in understanding the social patterning of alcohol use. So might it be important to look at mental health? And one reason is because we know that there is quite high social patterning of mental health problems. So individuals from lower SES groups are more likely to experience mental health problems. But also we know that there's a really strong comorbidity of alcohol misuse with mental health problems. So people with a mental disorder are more likely to drink more. In this area, you may have heard of the self-medication hypothesis, and that refers to the fact that people may drink as a coping mechanism to deal with stress or to deal with mental health symptoms. And I think there's a sort of traditional assumption that actually this hypothesis may apply more to lower SES groups, but actually there isn't much sort of hard evidence to show that. So I think that's potentially just an assumption that's been made. And one question that I would put to you at this stage in the talk is, what is drinking to cope? What does that mean? Is it having a drink at the end of a stressful day at work, or is it drinking to try and cope, to try and numb mental health symptoms? And I think actually that term could apply to a range of situations. So the work that I'm presenting today, it follows on from other work that we've done, which is looking at taking an intersectional approach to understand socioeconomic status. So in that work, we've used a statistical approach that looks at how people cluster based on a range of SES factors. So in using this approach, we think it's better than just relying on a single measure of SES. So for example, just someone's social occupational class may not give us a bigger picture. And if we use an intersectional approach, we can identify people with multiple advantages or people with multiple disadvantages. So what we did in this work is we looked at how people clustered based on things such as their social occupational class, household income, their household tenure, their educational attainment, whether they had any debt, whether they're in receipt of benefits, and also their residential mobility, so were they moving a lot. And from this we found 6 different SES groups. So you can see class 1, this is our sort of most advantaged group, so it's people in professional managerial occupations, but also with other advantages, so they're more likely to be homeowners and less likely to have debt. Class 2 were also predominantly in professional managerial occupations, but they didn't have as many advantages as Class 1, and they're more likely to be moving regularly and to be renters. We then also had a class of those in skilled and semi-skilled occupational groups who are renters, a class of students, and then we had two classes, so two groups of people who were economically inactive. And one benefit of using this type of approach is that it allowed us to distinguish between economically inactive groups, because in a lot of studies we end up just putting everyone into the same category who isn't currently in work, whereas actually there are quite big differences between these two groups. So Class 5 is the most disadvantaged group in that they were economically inactive, they were renting, but they also had high levels of benefit receipt, high levels of debt, lower educational attainment, whereas our other economically inactive group, they had higher educational attainment, they were homeowners, so we could distinguish between these groups. And the work that we previously did on this, we were looking at how did mental disorders differ across these groups. And we found that Class 5, so our most disadvantaged group, were those most likely to have a common mental disorder. Okay, so moving on to this study, then the aim was to use these latent classes of SES to look at associations with alcohol use, to then look at how people's reports of drinking to cope, how they might differ across those SES groups, and then finally to look at the roles of mental health and drinking to cope and explaining the social patterning of alcohol misuse. So I know we haven't got much time, so I'm just going to quickly give an overview of the methods. So the data is from the South East London Community Health Study, which you may have heard about in other presentations today. So it's a household community study. People were initially recruited from 2008 to 2010. I'm going to be presenting on data from CELCO 2, which was conducted between 2011 to 2013. So there are over 1,000 participants in this study. And South East London is more diverse, both in terms of SES, but also in terms of ethnicity, and that is reflected in the survey. The measures that we use to assess our outcomes, so we used the alcohol use disorders identification test to identify whether people were meeting the criteria for drinking hazardously or drinking harmfully. So we weren't looking at alcohol consumption on its own, we were interested in these two types of behaviours. So hazardous may be people who are regularly binge drinking and other problematic behaviours that may result in health harms, but harmful drinkers are people their current drinking is at such a problematic level that it is definitely likely to lead to health harms. We had a measure of common mental disorder, and then in terms of coping, people were asked whether they drink alcohol to cope with general stress, and we distinguished between people who reported this never and rarely compared to some of the time or most of the time. Okay, so on to the findings. So this graph is basically showing you the odds of both hazardous and harmful drinking across these SES groups. And it's the odds compared to the professional homeowners class. So it's looking at what are the odds compared to the most advantaged SES group. And the things that stand out, in terms of hazardous drinking, actually after adjustment for these demographic factors that you can see on the slide, there weren't major differences between the SES groups in terms of the likelihood of hazardous drinking. But what we did find was that harmful drinking was more common in the professional renters class and in both of our economically inactive classes. So in the economically inactive renting class and in the economically inactive homeowners class. So it's the harmful drinking where there seems to be socioeconomic differences. And that would kind of fit in terms of the alcohol harm paradox, that maybe it is about the way that people are using alcohol. So moving on to look at who reported using alcohol to cope with stress. And what you can see is actually it's potentially not what you'd expect. Okay. Using alcohol to cope with stress was more common in the professional homeowners class. It was most common in the most advantaged group and significantly less common in many of the others. So the next slide is showing what happens in terms of the socioeconomic patterning when we adjust for someone's mental health. And what you can see is most of the associations stay the same, but the increased risk of harmful drinking in our most disadvantaged group, so in the economically inactive renters class, actually this association attenuates and it's no longer statistically significant, suggesting that actually harmful drinking in this disadvantaged SES group appears to be explained by the fact that they're also the group most likely to experience mental health problems. So I know I'm pretty much out of time. So basically, just to conclude that this study does replicate previous research on the alcohol harm paradox in that it seems to be the harmful alcohol patterns of use that are more common in the most disadvantaged SES groups. And it really highlights the important role of mental health when considering those most at risk of alcohol harms. And it seems that actually using alcohol to cope with stress doesn't appear to be explaining the social patterning of alcohol harms. So really, I think in terms of future work, we need to be taking mental health into account, and not many of the studies that have previously looked at the alcohol harm paradox have accounted for individuals' mental health. So I'll finish there. Okay.
Okay, thank you for another great talk. Are there any quick questions of clarification? There's one at the back.
Yeah, just a quick clarification about the categories. I just wondered is there a case for looking at young working age adults who live in a parental home as a separate group or not, do you think?
Young people, so there weren't really many of those in this sample. So we had a class of students, but that would have been the main group of young people. And then the professional renters group, they were younger, and I think that was reflected in the fact that they were more likely to be renters and have greater social mobility, but they weren't living at home. But yeah, that could, in terms of studies in young people, that could definitely be interesting.
Thank you for two great first talks. I think we'll move on to the third talk, which is, there's a slight change to the talk. It's going to be given today by Effie Argyropoulos, who is from Camden and Islington Public Health. And Effie's going to be talking to us about health and wellbeing referral hubs in the London Borough of Islington and Camden.